Hawaii Pacific Health Hospital chose to support our Patient Emergency Assistance Fund. These funds assist uninsured or underinsured patients receive some of the most basic things, like medication, medical equipment, and transportation. Generous support to these funds extends our care to people in the community who deserve extra help, people who many times have no one else to turn to. Your gift can make all the difference.
I give because every dollar makes a difference.
I give because I care about the patients and I care about the hospital.
I give because it's a privilege for me to share with someone who needs something.
Over the last 2 years, the Ohana Fund here at Pali Momi has helped over 300 people, primarily with the discharge medications and their equipment. It's enabled them to be able to leave the hospital, to get better. We've sustained them in the community and prevented readmissions here.
A lot of the medications can be really inexpensive, but for some of our patients that need, they don't really even have those few dollars. And if they don't get the adequate treatment, the antibiotics to treat that infection, they end up right back in our emergency room and right back in our hospital. And so this doesn't help our community at all. A lot of times these really can be life-saving medications for these patients.
Employee giving campaign is a big impact for the community and make the difference for the need of others. Giving together make the difference of the people here in the community and Pali Momi and make someone's life happy.
I give because I can. Here at Kapiolani, we see families that get uprooted from their home, and it's scary and it's financially devastating, and I can help out, and it keeps me connected to the work that I do every day.
I give because as a mother and grandmother, I totally support Kapiolani and a loyal and dedicated staff.
With the Pediatric Hematology Oncology program, we use the family funds to help pay for some of the cancer medications that aren't covered by insurance or may have an upfront cost to the patients and the families. We also have used it to pay for travel for a parent or a relative so that there are 2 adults here to be with the families. If you can imagine our neighbor island families, I think the fund is most impactful with them. They oftentimes go to the emergency room or their pediatrician for what they think is a cold or headaches, and then suddenly they're faced with the possibility of a cancer diagnosis and being flown to Honolulu. So it's utter relief when they realize that they can receive some financial support for the medications, for flights over, for a second parent, for flights that may not be covered with private insurance. Any of those instances, they are just really relieved, and you can just see the worry lines fading on their faces when they hear the news.
I give because it really makes me feel good.
I give because it will help my patients.
I give because every donation counts.
In May of 2015, my heart was starting to go into ventricular tachycardia, ranging from 160 to 180 beats per minute. I got shocked twice within a 2-day period, and it was very scary. They requested that I go to Cleveland Clinic to get my heart re-evaluated for the heart transplant.
Finances were a big problem at the time. She was facing mounting medical costs.
Unfortunately, insurance company said there's no way we're going to pay for the medevac flight, which is how the Kukua Fund started. We just knew that this was her only option, so we knew we had to do something to get her where she needed to be.
And she said, "Don't worry about getting to Cleveland, we're going to pay your way." And she started to explain about the Kukua Fund.
Initially she was in shock and didn't really know what to make of it, and then it went to no, that's not something I think I'm a candidate for. There's so many other people who deserve it more than me. And then as I explained it more to her, tears started coming, and then she kind of understood that this is something she needed and something that she deserved.
I won't forget that. I won't forget that. We cried, my daughter and I cried. It's a blessing, Mommy, because we can take you now.
When I can step in and say, insurance can't or won't do this, but we can. And Kukua Fund can help you bridge that gap between where you are and where you need to be. It's the best feeling to deliver that wonderful news to someone. I think it means even more to them to know that, the nurses and the doctors that they've been working with are now going to help facilitate whatever their needs are.
I give because I care.
I give because it's helping our patients and it's helping our community. One story that comes to mind for me is a 9-year-old child who was here with a possible diagnosis of cancer. The child needed further testing, needed to be done at Kapiolani. Unfortunately, the insurance would not cover the flights. Luckily, we had the Patient in Need Fund, and Wilcox was able to fly the patient and the family over to Kapiolani to do the testing that needed to be done.
We had a newly diagnosed oncology patient, and we helped him with a $30 bus pass, which enabled him to get to all of his appointments. $30 wasn't that much, but it was so helpful to him.
The fund allows us to continue our treatments that we start here at the hospital beyond the walls. It allows us to continue therapies that otherwise folks might not be able to afford. And that's really important because we want them to be able to stay out of the hospital with their families.
I give because it is a personal contribution. It may be a lot, it may be a little. It's not the amount that we give, it's the act that we give, that we actively participate. And participation is the ultimate contribution.